Hi, I'm Stephen Hann. I'm running for Mayor of Onkaparinga. Today I want to talk to you about emergency departments, and specifically emergency departments in the Onkaparinga area and for residents of the Onkaparinga area. Now my mother would say, well Stephen, you're running for Mayor. Mayor has nothing to do with hospitals. And I'd say, well, yes and no. We're a community. So we're a community of 170,000 people and we need services. We need hospitals, we need schools. And as a mayor, you can physically talk to people. You can go and talk to the State Health Department, you can go and talk to the members of Parliament in this area and all of them and say, look, this is what's happening with our hospitals and here's some statistics to back up my claims. Now, then if you don't get any groundwork, you can then go and talk to the State Department of Health, you can talk to the Premier, you can talk to the Minister for Health with these statistics. Now, I would guarantee, absolutely guarantee, that the local members, the Minister for Health and the State Department of Health have not looked at these statistics. And you're saying, well, why would you say that? Because as Director of Hospitals for 15 years in the Commonwealth, I can tell you how many people look at the statistics. Not very many. Now, when you bring statistics up to people in charge and say, look, we could do things better, and why are things done like this, things often change. And I've had many instances where things have changed when I've just brought up to people's attention, this is what's happening and this is how things could be better. Now, if you want an example, from Canberra, so I was based in Canberra, there was people coming from the south coast up for renal dialysis every week, every 2 days, by ambulance to be treated in Canberra Hospital because there was no renal dialysis down the south coast. I presented this to the Department of Health in New South Wales. All the people travelling up, getting treated in Canberra, then going back down by ambulance every single day. And how much this was costing New South Wales Health. Now, I'm not even talking about the care for customers having to be treated for renal dialysis every 2 days and having to travel 3 hours up and then 3 hours back. Basically, it was a whole day and half their life is spent travelling to be treated. A lot of customers would obviously choose to move to a location closer to a hospital, but there was obviously people who couldn't afford that. Anyway, New South Wales Health, obviously, well, actually, when I say obviously, they then installed a renal dialysis unit down at Bateman's Bay, and that got rid of most of the people travelling to Canberra for renal dialysis. So saving New South Wales a heap, and obviously making the lifestyles of people with renal dialysis much, much better. Now, let's look at ED departments. So I've been pulling off statistics on ED departments in our state because I'm very interested in this. And why am I interested in this? Because when I've had to go to ED, so when my mum goes to ED, there's a massive wait time at Noarlunga and at Flinders Medical Centre. I wanted to see, well, how does this relate to the state? How does it relate to the standards? So first off, I want to talk to you about emergency departments. So when you go to an emergency department, you are triaged. And what that means is they say, well, this is how urgent you are for treatment. So they class you, and I'm going off the top of my head, from a level 1 to a level 4. I think that's right, it might be a level 5. That's the way it was. It's been many years since I worked in this area, but basically, if you're a higher emergency, you're treated before the people of a lesser emergency. Now we have national agreed standards on treating patients in a time. So each triage category, so if you're very high urgency, there'll be a standard for which you've got to be treated. If you're a lower urgency, so let's say you've bruised your big toe, then you've got, we can spend longer to have a look at your big toe. But if you've had a heart attack, then we will see you very quickly. Now, I want to talk about Flinders and Noarlunga. So I'm trying to pull statistics to see what the average wait times are in Noarlunga Hospital and Flinders Medical Centre compared to, let's say, Royal Adelaide Hospital, and I'm going to say a marginal electorate. I don't know if that's what it is, but anyway, I can't find them. All I can find is really that about 20% of patients treated at Noarlunga Hospital are treated in the agreed standard times. So 1 in 5 patients are treated in the agreed times. But what I found was there's an app on a website which shows you the current wait times in every hospital in the state, which is awesome. A little bit hard to kind of figure out, probably hard for you to find, but it's pretty amazing. So what I've been doing is I've been doing snapshots every day of wait times in the hospitals. Now what you'll see in all these little graphs, and hopefully I can pull up a whole lot of diagrams on wait times in our hospitals, is wait times in Flinders Medical Centre and Noarlunga are always, and when I say always, substantially greater than the Royal Adelaide Hospital. And what you'll often find is Royal Adelaide Hospital wait times are actually not too bad. Where you'll see the wait times in Flinders and Noarlunga are often maybe 6-7 hours. So you're waiting on average 6 or 7 hours to be treated. Now you'll say, well, Stephen, it's because people are going there for their bruised toes, and that's why we're running a massive TV campaign to stop people going to ED and go to your doctor or go to the pharmacy or just, take a Panadol at home. Maybe that's the case. But then I thought, well, Stephen, how does this compare to, let's say, Queensland? So I thought, well, has Queensland got statistics on this? Because it's a national data collection that's collected. And how does it compare? Now, just on this point, at the last election, Labor ran a campaign about ramping, saying how bad the wait times are in hospitals and they're going to fix it. So they were saying Liberal is doing a really bad job of emergency departments and wait times. Okay, I'm not disagreeing with you. I'm just saying, well, how is it now? How is it now, and can it be improved? And is it this across the state, or is it just in our area, for patients in our area, in the Onkaparinga area? So I started looking at the hospitals in Queensland. So I picked hospitals like Rockhampton, 20-minute average wait time. I'm pulling these numbers from the top of my head. And I thought, well, Rockhampton's got a population of 75,000, half the size of Onkaparinga. But it's got a pretty decent sized public hospital. Then I thought, well, how about Cairns? Cairns is a pretty big area, 18-minute wait time. And I was like, well, how about some other hospitals? And then what I see across the state, I went down to, Gold Coast and other hospitals, is I saw an average wait time of around 18 minutes. So if you go to an emergency department and you're in Brisbane, you wait about 18 minutes to be treated. If you go to Adelaide, or if you live in South Australia, and in particular you live in Onkaparinga, and you go to Noarlunga or Flinders Medical Centre, which is going to be your go-to hospitals for emergency, the wait times will be significantly greater. Now you can say, well, Stephen, how can you fix this and how things? Well, first off, you can have this conversation because we do have agreed standards. There's national standards, and you can say, well, we're short on doctors. Now, when I've been to emergency departments, I'm not having to go at the staff because the staff, and it's particularly the doctors, are under the pump. There are queues of people out of the door, and there's one doctor who's literally got queues of patients, and he goes from patient to patient to patient. Now, this one doctor, this is from my experience, after he treats the patient and assesses them, he then has to fill out a whole bunch of forms. Now, again, from my experience, there seemed to be one doctor. One. Now you can pull in doctors. In fact, the medical advisor in our area, in the hospital's area, in acute care, worked part-time at the Canberra Hospital in the emergency department. So you can pull in doctors to work in the emergency department in times of need to reduce these wait times. Or you could just employ more doctors. And you can say, well, how much is this going to cost? If there's one doctor, maybe we should have 2 doctors. Maybe we just need a doctor and a half. Maybe we could have different programs. There's been a whole bunch of programs trialled around Australia in hospitals where you set up like a clinic outside of an emergency department and people can be treated in there and be bulk billed. There's been a whole bunch of trials, and I'm not across the trials that have been done since I've been out of this area. but there's conversations which I think need to be had. And at the moment, I do not see any focus on this for patients in our area. I see nothing. I don't see any of the politicians talking about it. It's like, well, 75% of people voted for Labor down here, so like things must be really good. And what I'm saying is, I don't think things are good. I think things need to be brought to people's attention and say, well, look, there's a big difference here. There's a whole bunch of people being treated in Flinders and Noarlunga, actually quite large numbers. And actually it's not that much different to Adelaide Hospital in numbers. And it's like, what's the staffing levels here compared to other hospitals? And maybe we need a little bit more assistance here to return our wait times to national standards. Anyway, I'm running for mayor. Hospitals are key to me. They are absolutely key, and services. We've reduced our hospitals, McLaren Vale and Noarlunga, to basically, I'm going to say second-rate hospitals, day surgeries. I'm not having to go at the hospitals. You know, I've found it. If you live in Aldinga, let's say you live further south in Yankalilla, because we all know Yankalilla and we holiday down there, and something happens to you, chances are you're going to have to go by ambulance to Flinders Medical Centre. It's a lot further, and I say a lot further, it's more time to get to Flinders than get to Noarlunga. Flinders is already jam-packed. There's no car parking. Staff have obviously got car parking. Noarlunga would be a great hospital to put more services in. And it's not like these hospitals didn't have more services in the past. I was born in McLaren Vale Hospital. Can't be born there now. In fact, you'd be struggling to be born in Noarlunga Hospital. And these are the questions I want to put to our local members and say, look, why aren't we doing these services? Now, some people will say it's because of costs, because these hospitals are small. Well, luckily, I was responsible for the cost collection for public hospitals and for private hospitals, so we can have those conversations about costs in these hospitals. Because it's clearly not the case that the costs were higher for these hospitals. Well, maybe we should have a conversation about costs in hospitals across Australia for like births, for chemotherapy, for renal dialysis, and maybe we should have renal dialysis clinics further south for people to make their life easier. Maybe McLaren Vale should be doing renal dialysis as well to make it easier for people down there. And we can pull up all these statistics. It's very, very simple to do. In fact, I got a few awards for it. 2 awards, anyway, from the department for doing this exact work. Anyway, I'm Stephen Hann, and I'm running for Mayor of Onkaparinga. I'd appreciate your vote. If you want to improve hospital service, you want to improve education, you want to improve funding for down south, services delivered down south, roads, that's why I'm running. That's why I put up my hand, because I'm like, well, I'm not going to sit here and complain about it. I'm going to put my foot forward. I'm going to work. I'm going to get results. We're going to talk to people and let's improve things. That's why I'm running. Anyway, I'm Stephen Hann. Thanks for watching.